Even top Hollywood doctors, we they see how many celebrities have gone through these procedures and they end up being botched, and we see,
You're waiting at box because of this, so people know that certain procedure where anybody they do not skin, you need to be medically trained or a practitioner. We don't go to medical school either as a nurse or nurse practitioner, but let you equipped because you need to take a responsibility, not just for put something at somebody in body, but the after effect you understand.
You they see people them, it's not like they're not certified. They get certificates from Sonsai. But like you say, when you're doing a medical procedure, if you dey go do surgery, if you dey go na theater, the doctor they tell you waiting again for do. They seek your permission and full consent. They tell you the risks. They tell you waiting go be the possible side effects. Even Panadol, even on the packaging, they put what the side effects are.
This body where we get is your temple. You might feel you're going in to solve one problem, but in the hands of the wrong individual who does not have the knowledge, it can cause more harm and permanent harm than good.
Welcome to Honestly Speaking, the podcast where we have honest conversations about the issues shaping our lives. I'm your host, Antonia Howard. Today we're talking about beauty and cosmetic treatments and procedures. Now, this is a global trend all over the world. Cosmetic procedures, or should I say the cosmetics and beauty industry, is booming. From Brazilian butt lifts, BBLs, lip fillers, Botox, and even weight loss drugs. We've seen Ozempic, which is a diabetes drug now used for weight loss. And Sierra Leone is no exception to this. Now, Salon, we see increasing advertising for these beauty treatments, from skin glowing injections and drips to body enhancement surgeries, and more Sierra Leoneans are investing in these treatments that promise instant results. But just like most trends, there are risks to be considered. Sometimes there's a lot of misinformation, sometimes unsafe procedures, and I think the biggest thing for me is the lack of regulation in this growing aesthetics industry. So today we ask, what should Sierra Leoneans really know about cosmetic procedures? And how do we build a culture where beauty and health go hand in hand and people can get access to the right information so that they can make informed choices? My guest today is Dr. Essie Thomas Macaulay. She's a medical doctor and a public health advocate, and also the founder of Footprints Sierra Leone, which is a medical aesthetics and weight loss center. Welcome to Honestly Speaking.
Thank you so much, Antonia. This is awesome. This is privilege. It's about time. And it's a total honor to do this with you. And I think it's such a relevant topic.
Yeah, completely agree with that. I think because this is such a trend now, we see it everywhere. We see people, then they go into sometimes not even a clinic, sometimes it's a beauty salon and they're getting injections. And we don't really know, we don't really understand, not many of us understand what are in these substances that we're putting into our body. But I think a good place to start is maybe your opinion about why there's this growing market for this.
It's interesting because I have been thinking of bringing this conversation out, so it's even better that I'm able to do it with somebody who does this. Now, as I said, the beauty industry has always existed. In medicine, it goes between what we call cosmetology, medical aesthetics. Now, definitely, as you said, the cosmetic industry is there. It's been existing to complement what us as physicians do in terms of dermatological treatment. which in terms of what dermatologists would do is more like the treatment that has a lot of chemicals in it, medicinal formulas, and not just for beauty, but also for like treating pathological situations. Similarly, in the plastic surgical department, where people don't like certain aspect about their face, their body, their shape, they want to change something, or they don't undergo a drastic change like weight loss, as you mentioned. People lose a lot of weight, and because of that, um, sagging skin, wrinkles occur, and it helps you feel better when obviously you're able to feel better about yourself. So losing weight and feeling healthier is part of it, but sometimes the outside does not match the inside, and that's where the aesthetic part comes in. Now, when it comes down to aesthetic, let me break it down. There is what they call the cosmetic angle and then the medical angle. For various treatment that do exist today, be it the Botox, the fillers, the threads, the PRP and everything, there are internationally, there are a set of boundary as to what the cosmetic industry should do and what the medical industry should do. So even overseas, in fact, in the States, even if you're to do a cosmetic procedure and you're not a doctor, you have to be of a medical background. And this is especially so because this body where we get is your temple. You might feel you're going in to solve one problem, but in the hands of the wrong individual who does not have the knowledge, the person will not get knowledge for do the right thing or not understand the structure of your body on a deeper level, it can cause more harm and permanent harm than good.
So you talked about internationally, some kind of boundary exists when it comes to what someone who is probably qualified to do certain cosmetic procedures can do.
Yeah.
Something like that they exist for we in a salon.
Sadly enough, not yet. And I no go blame people them way, for instance, they seek opportunity for do something, you know, they want to look fine. Either they don't know the right person for go to, but this person they advertise, they don't claim, say they do this, they do that. There are multiple levels of awareness that needs to be put in place because when one, the person ready to go meet, not equipped for understand the anatomy, what I mean anatomy, how your body is structured there on the inside, and you go begin put poke needle inside your body, it can cause permanent and long-term damage. Two, if the product where it bring come, especially for inject inside your body, I not say that one way then just put on top, massage your skin on the outside, that's different. But the minute we person they go through your skin with needle, or they do the very, very strong peeling, your skin gets several layers. The cosmetician only allowed to go through the first layer. Beyond that, you need to be medically trained. Now, a lot of people, they come with some kind of certificate. I would tell you, say, I think there was a broadcasting program not too long on BBC, where even Britain, we regretfully train a lot of people where they internationally right now go to the same Harley Street or similar kind of institution and get some kind of training, whether officially or non-officially, I don't know, but in all means say, waiting then do for England, because then self not be regulated, not forget that. Now them pass on England Parliament, say certain procedure where anybody did do na skin, you need for be medically trained, or a practitioner. We don't go to medical school, either as a nurse or nurse practitioner, for let you equipped because you did take a responsibility, not just for put something at somebody in body, but the after effect you understand, and plus decide where you put them inside that person their body, you for know exactly what's in they happen. And the face, especially, is one of the most dangerous places. Most dangerous places where anybody you for allow for put needle just, I mean, if I tell you, say, even with doctors, errors do happen.
Yeah, we see it. We they see even top Hollywood doctors. We they see how many celebrities have gone through these procedures and they end up being botched. And we see, you know,
You for explain our botched because sometimes so people don't understand.
well, you
like,
explain. Yes.
Botched now way you go for go get something. You don't see one nice celebrity in picture. You take that picture there. You go meet a particular individual. You hear say they inject Botox or fillers. Fillers now like this substance where medically they make them for improve the texture of your skin. But fillers, they come in various type and various quality. Right now, internationally, then is struggle for control the fake one them within the industry. And then fake one and they don't enter Africa big time. So we do certain institution in Nigeria, then it trade, people then go there, then go for one certificate. You just see certificates now, like, you know, like some of them, it's in a better certificates where they advertise. That's why we don't get an now for the medical aesthetic industry. So if you go, me we go school. If I tell you how long I go medical school, plus almost I pay for go through certain training where we don't do an a medical school, but where be ready for bring and count to me people in a salon. I go back, I go revise my training when I pay for. Besides the pay for, I take the responsibility for work with people that when are the trainers, where they train doctor the like we. And also the product where they bring come, and also FDA approved, meaning the association where they qualify, say them products are not they come, we need to offer them to people then so no more. We don't test them, we don't do research panel, we know say it qualified for where them put them on person and it cause things like cancer tomorrow. Or where them put it inside your body, and it go somewhere else now your body, and it sneak through your vessel, it go somewhere else, it go cause heart problem. Or where we put it inside the body, this not the time where we know say we don't put it on your body, and it take this long for act. We know enough about this product. Now so many of them product then don't come on now. The other country them, I don't want to call names, where even England, they struggle, even some of the top hospitals or clinic medical spas in England, they struggle for get rid of them product then they. Very few countries in the world have done very, very well, and funny enough, the smaller countries have done very, very well for regulate products the way they come, just like how they talk, say food they come, they need to regulate. Not the same thing, medicine they come, they need to regulate.
Yeah, I mean, we definitely have a regulation problem in our salon because even the drug crisis where we see now, we have one of these painkillers, tramadol, as you know, one of the culprits where they cause problem right now. And this makes me think about how easy or difficult is it for a person just bring in certificates, set up on site. In fact, you don't even need a building. You can basically do it inside. So, inside your room. Because Nadane made a scene at TikTok. That's what I see on social media. You set up a company, you set up Footprints Sierra Leone. What was it like setting that up? What kind of regulation? What kind of certificate did you need to have, and how did you register that? This was what, 2018?
Longer.
Yeah. Long ago. So I just imagine what the change would have been and how easy or difficult it would be now.
First of all, setting up the company, you go to the right channel, corporate affairs, you pick your name, Afemi lawyer, pay me lawyer, wetin I need for do, guide me, wetin at the right institution. You set up your M&A, meaning you get for put wetin your business to do, so you take the responsibility as a company for say, this and this my business supposed for do, and you need to work beyond that boundary, okay? Where you don't set up medically, we're not legally supposed for advertise, okay? You can educate, but not advertise. So now I make people in ask, why you need to advertise? I'm like, I'm not supposed to. And internationally, we don't advertise as medical facilities. So you have to be knowledgeable about how to bring the information and knowledge, and which is why I can comfortably sit here and talk to you about this, because it's about knowledge sharing. I want people to ask me questions, whether online. Now, I can't take the responsibility about the regulatory system, because there's a whole collective of situation that needs to be resolved from the back end. Yes, I don't approach the medical council about the influx of these facilities, how are they regulated. I offer to support them, and they have their own challenges. I believe they have considered it, but how far they've worked towards improving policy, and not just improving, but implementing these policies, because right now I look like anybody we don't play around face, feel say I can inject.
Yeah, that's exactly what it's looking like.
And the poor patient, not get no side for cry go, because you go that person, they inject you. First of all, you sign any document with that person, they say, wait, it treat, where you go na theater? Officially, that doctor, they make sure say, it give you information about where they go for go do na your body, and the risk where they inside there, and the consequences we can, including death, possible for happen. And at least you don't aware about waiting, especially a responsible clinic, okay? And a day we supposed for the inspire for go, for lay, we improve services and improve healthcare, na salon. But a lot of people out of desperation, maybe the money we get, and then offer and say, pay anything no more, because that person, the way they inject, desperate for making your own small thing. But you self forget conscience, because if what you inject inside somebody in face, you're not aware about the consequence of it. You're not aware about the studies we come up behind it. I mean, I can obviously talk about it like I do right now, which is why I'm happy you brought this conversation up. But are the big young people them, well, even elderly women, we take responsibility, say them body not in temple. Even though you want to do something, check the resources. Go online, ask, what you are supposed for nobody's procedure where we are supposed for do? Who are supposed for do them? What are the kind of products them? And even the product them where gets big name, and it is say smaller name products, they know they exist. But go online and yearly research for yourself. Then other name where the doctor say they can use now your body. Ask body product. You get right now. I mean, at the better part of internet these days, half of the information. I mean, some people are not like where patients they ask Boko question, but I like to deal with the patient who ask me question, because if I'm not able to answer you, I always say, give me small time. I'll give you a stronger feedback. If I don't know, I'll tell you I don't know. Yeah. My conscience to the work where I learned for do over 7 years in a medical school, and over 22 years of medical practice, right? I value it, because if I cannot bring quality to my client, then I haven't done justice to myself, to my family, the God that I serve, and to the people that deserve better of this country.
Yeah. Out of curiosity, I'm just tempted to ask, what's in the inside them products there, just generally, and can these, is there an alternative? Like, for example, now something I see happening a lot is people, they go take either the skin lightening IV drip, or they call it glow something. Can this be, can you get the ingredients from food or from vitamins? What's in the inside them products there?
Okay, so the aesthetic industry is a very, very interesting one because every day it evolve, it expand, and they're bringing so much to people. Like with for instance, the most common one we all might not they talk about is Botox, right?
Yeah.
Botox is a neurotoxin, meaning it's a form of toxin we use for cosmetic purpose, but we use them a lot for medical purpose. For medical purpose, we get people then way, for instance, don't get difficulty for like pass food inside belly. We dey do procedures where they inject them inside belly. People they get difficulty for pass stool, we dey get for use them not in place then they. For people where they get spasm, we dey able for use them. Like for instance, if you get people where they twitchy eye plenty, we dey inject them around the inside and they. For people who constantly they get like clenching of their teeth, we use and these are all medical reasons. And also we use them for like paralyzed muscle, which is where people who they get wrinkles are people quite often where they're constantly moving their muscle. And you have movements where make you see boku line or sometimes few line begin appear. So that is where the cosmetic angle comes in. And either one, because it is with the aspect of putting toxin, right? We can paralyze that area there. It has to be done by somebody who takes the responsibility of putting it where exactly it's supposed to go. And as I say, even with we wait on land book almost decade, as I said, over 2 decades, right? We can sometimes make mistakes because the anatomy from one person to another person is not the same. So like how I did treat, for instance, if you were to come to me and say, I want treatment with Botox, and not like the wrinkle there on my face, and not like how me eye they make one kind of way, how I they treat you, the dosage where they put in your body is totally different from the next person. And it's because the medical knowledge and the experience what I have, I would analyze you, I'll get for touch your body and tell you, say, this is how I'm going to treat you, and then you pay for what you do receive. So that one way, hey, but this $9 person pay. No, this not a Panadol. Not a Panadol where you know adult 500 milligram if you take 2 every 6 to 8 hours. Now I make you can buy Panadol any size. Botox is a neurotoxin. It should be given as a prescription. So if you're not a doctor, you're not a medical individual, you're not supposed for the prescribe them, let alone get the right for inject them into somebody's body.
Wow.
It is not just illegal, it is unethical because you can disrupt that person in body long term and create more permanent damage to that person there without even being aware that this is what you have done.
So, what are the red flags people should be looking out for? Because I'm so scared now because they see people them. It's not like they're not certified. They get certificates from Sonsai. Some people display it. Some people don't. Some people go tell you, say, oh, I go train at this country. I went there for 3 months. That's where I got my training. But like you say, when you're doing a medical procedure, if you go do surgery, if you go in a theater, the doctor, they tell you waiting, get for do. They seek your permission and full consent. They tell you the risks. They tell you waiting go be the possible side effects. Even Panadol, even on the packaging, they put what the side effects are. So for some of these things, you have access to the information, but I'm just thinking there's not enough information for people who are interested in this. And I just wonder, what are some of the red flags where people for the look for? What do you see and run?
First of all, I'll say stick to a qualified medical professional, and I know they say past doctor. Well, in we country, we don't have what we call nurse practitioner, which is like a higher qualification of nurses. Now, America then train, because they're many short doctors, then train a certain qualification and create a qualification for filling the gap. So where you don't work as nurse or you evidence they say you capable for deliver to a certain caliber and take the responsibility and you're able for study to that level, they give options for let you train and become waiting and call nurse practitioner, meaning you even get right for prescribe medication for people and you get right for administer up to a certain treatment for people. You ask me about glow skin, then all and now where you give somebody their medication and they not the same way one fits all. Some patients where they come, doctor, I don't hear about this. You did one once I get time. I can say, first of all, would I get free money for just go bring them come? You can advertise anything you want, not so. For let you offer somebody down there, you should do a basic blood test. You should do a basic blood test. Wow. If person wants a specific treatment, you for do certain blood test, and for able for interpret that blood test way, a medical practitioner able for interpret blood test responsibly, and with that interpretation of them blood test, then they be able for take and say this person, the product way it ask for get let we say for instance the glutathione IV, right? Glutathione is like an immune booster. It comes in an IV nowadays. They have the less potent version that goes in certain medication, which is less complex to give to a client because it's not as strong. Where you begin put glutathione IV into somebody in vein, do a lab test, or you take all the combination IV therapy, you begin injecting inside somebody, do a basic blood test. Gosh, you have to be careful or blessed or pray God somebody not just sit on quiet and just go quiet in your chair. It has happened in hospitals. It has happened in med spas. So then are you where you feel say you just too lucky for the do sometimes that person that they come on now you bed, now you chair, you wherever you don't make as you so-called clinic where you now doctor, it gonna us it begin feel bad. You go deny say you not take anything. So if the person way you go for go meet for inject, first of all, not a medical practitioner. I think that's not the first red flag. And not get a proper certification, say as a medical practitioner, I don't get this training. That's another red flag. Because even doctor themselves, right? I should say my colleague then get sense than for just go begin take needle and injection, begin inject people. But we will wait for big papa government say, do a step in small bit and put more stronger vision, say, we people in health long-term matter. If we try for prevent all the cushions and we can do a little bit more about it in advance so we prevent the more adverse effect long-term. Now, elsewhere, the bigger countries, the UK, US, certain states, the regulation from each state to another state different. But I'll tell you, say none of them are the way. If you're not a nurse practitioner or a senior qualified cosmetician, you practice under a supervision of a medical doctor. And then they say you get a limitation as to which procedures you're allowed to do and which procedures you're not allowed to do. For instance, like peeling. Peeling is such a complex treatment that even, especially in our society where you're gonna do dust day plenty, you're gonna do year round, it's sunny.
Sunny, yeah.
Oh boy, you go sit down under somebody, you don't know whose product to use, you don't know the understanding, but them products then they tell you, so this nine and you use yanda. Do you self your own research? Whose product that you do use? What you want put in my face? How deep that product they go inside my skin? We get peeling where we can remove up to 2-3 layers of the skin. And I know say people and do anaya. And not to medical people and do anaya. You don't make you now like how plenty we people, we young lady them, we woman them, the bleach. Bleach is a form of peeling where we don't know what they do to the skin because now like we all get what we call like the epidermis. When I like a clean film where you need to see with your hair, where they cover your skin. It's what God blesses you with for protect your skin. And especially as Africans, we're dark pigmented, so we have a very good level of protection. The minute we begin use the cream, then it peel that clean film day off gradually. Quite often, it depends on the kind hash, the caliber of hash chemical way they use, it peel the force. When you use them constantly, and especially you know to protect your skin, you know to moisturize properly. And what I mean protection, if you're not supposed to bleach your body, you for constantly they rub waiting and call SPF, sun protection on your skin. When you know they apply down in at the skin, this sun where we all the work under, it give constant UV rays and UVA and UVB rays, where the damage where the sun they do na your body can lead to skin cancer. Now, if you're not a responsible person, you know, say, you do rub that cream in your body, you don't hear this message, say, oh, this cream here, it pull the first layer on my skin. I make it look like, say, the yellow. It make you look like, say, you yellow for a while. But then when you look like, say, the yellow, then you know, they protect your skin with what they call the SPF. And then perhaps you go use all that kind of cream where they cause of the damage. You go begin see certain area then at the body where they pull two different color. Let alone, let God forbid you wound. The healing process not take place properly. You might notice one wound day where they take a long time for heal. And not they heal properly because same way you continue for rub that cream day instead of you go see doctor when a specialist for say, I get this wound, I don't know what's in the drum, and it take too long for heal. That is a big red flag. So if you get skin sore where you're not supposed to bleach and you need to heal quickly, it means say your skin don't become very vulnerable and high tendency for there be other kind of thing which can lead to cancer. And they say definitely cancer, but you'll be lucky to get away with it for too long.
Yeah.
And unfortunately, we don't have very strong cancer unit, skin cancer unit. We don't have a skin cancer department in our salon.
This is what scares me. The healthcare system in Sierra Leone is somewhat fragile. Even some, everyday treatments that people would go to any hospital, you go any side in a different part of the world, and you get treatments for. Sometimes here it's quite complicated. The access isn't there. The information also isn't there. And I think that's what and that they make afraid when it comes to this topic. Because if something goes wrong, we don't have what it takes to fix it. We may not even have what it takes to understand what don't go wrong. And it's really important. I think that's why this conversation is important, so that people have a better understanding and can just, be more careful when they make this decision. For you, how do you balance that? Because some people want this and they want it by all means. So sometimes somebody will come to you, they say, I want this treatment. Oh, I see I am, and I saw what it did for this person. But maybe when you look at the person who has come, sometimes maybe you do a blood test and they're unfit for that procedure, but they want it by all means. How do you balance that?
Maybe it's a bit of a gift. I try to educate my clients. Sometimes I put extra time into that because lack of knowledge, not to the person involved, but also when they don't take opportunity for educate you, but you insist, then say you can't blame anybody when something go wrong. It just be say not to me go be the person who go take it responsible because one, I not go want let something happen at my clinic. Two, I not go want me conscience for tell me say, I should have prepared you of the information where you need for know, way not just about the beauty part of it right now, but also the long-term implication when certain things go into your body. I cannot take it out. Certain procedure they will offer way, for instance, lip fillers. Lip fillers is like a foreign foreign substance we I want bring a candong, la bring a dong to local. Filler na something like gel we medically they make na lab for let it help with body for develop what they call collagen. Collagen, I like what you see, baby. Chubby cheeks, you call it oh cute cheeks. The collagen we all naturally get in our body, God the give you and where you born. And in your youth, your 20s, late 20s, you're supposed to get enough. Some people genetically get thinner skin compared to somebody else, where you will see, especially with African cultures, we do have a lot of people who get thick skin. And the other blessing back way in culture, we do have people who have thicker skin compared to the Caucasian skin. And by the time where you reach your 30s, you start for lost collagen. And aging, they become a bit more visible bit by bit, depending on, obviously, if you're blessed, papa, mama, old man, looking sparkly and nice, it might drag off longer. But with time, regardless, let us even by 40, you begin to notice signs. And waiting to create all that, the first thing is the loss of collagen. 2, the thinning of bone density. 3, the joint that way they between the tissue them, the anatomy structure, the anatomical structure that way they na your face, the joints that way they middle, where they like fuse the bone then together, instead they become narrower. Then another thing, gravity, obviously, all things they begin show down. So you begin notice certain sign like here, pan woman them with my old age, I should be comfortable to say, I don't want to look like 15. But if I want to improve and look better and all, perhaps some people don't go through harsher conditions in life. Sometimes by the time they're 30, you see wrinkles and all that. They make them feel very much difficult. I find it difficult for go through daily life. Either it's challenging to be in a relationship because they're judged harshly, or challenging to be at their workplaces because they're not able to present their ability because they're being judged by their looks. You'll meet some people, they're 40, 50, they're so youthful on the inside and everything. But when you look them at first impression, it kind of startled the onlooker for being assessed. And that obviously, we culture, European culture cannot take away. There's so much information about what's aesthetically called beauty these days. But in there, the customer safe, we get a lot of people that way. Sometimes you go treat, oh doctor, I get wrinkles and I don't want to see anything. I want small movement, but I don't want to see anything. You remove the wrinkles. But the fact that we make yourself in your go up, you're not happy. It won't let you freeze and totally. And that might mean you're giving excessive dosage of Botox. There are times, depending on your age, when you come to me, I try to talk you out of it. I try to explain to you the medical reasons behind it. Now, if you insist, I have the responsibility to know that if I overdo it legally, so now we don't begin to get medical lawyer then. Then go come back, come meet me, no, so? Yes. So if you insist and I feel it is outstepping the medical, legal boundaries, I have the right to say, I'm sorry, I cannot offer this to you because it is against the medical ethical values that I practice with. You might have to go. Or this is not what you offer Sefna Salon. You might have to go overseas where there are adequate setup for prevent possible reaction. You understand? So like, for instance, certain thing like peeling, as I see certain people, they do certain things. Once you do that, the amount of education you need for educate the person, say, why I do this to you today? For the next several days, now this and this and this I need you for protect damage we can begin happen immediately. We're not to see where you already see in terms of the permanent damage, but also for prevent a reverse of what you don't do. Well, the aging process not even come back worse, like discoloration, you know what I mean?
Yeah.
Quite often, the clients then go ask very superficial question, we're easy for answer. But when me to talk to clients, I not just look at you waiting at your own concern, I get for look at waiting at the concern. When me as doctor for understand if I put myself into that position, saying I may treat you.
Right. In terms of the legal or policy framework that we're currently working with in Salon, what do you think needs to be improved? I know say training for then services then I doubt if that exists in medical school here. Training for any cosmetic or aesthetic aesthetic procedures. I'm not sure, but you can talk about that if it exists. And also just in terms of guidance, what people can do, people who are practitioners, what they can do and what they cannot do. I'm also not sure that exists currently. So, in terms of what needs to be done, what are the key things that are important for a growing beauty stroke cosmetic aesthetic industry in salon?
I think the first way we need to start is education. Because both the people that way they do the procedure and the one that way they go there for the procedure, it's like all man fit for survive. As a medical practitioner, I know of any current training in terms of medical cosmetic procedures in Sierra Leone. Me certainly not the Alpha One because I not believe say me business then at that position yet where I want to take that responsibility because I won't want to do it haphazardly. I'm a bit of a perfectionist, but not to just the perfectionist angle, taking that responsibility to train. And I need to know that if I step into that level, that the system offers the boundaries, that it regulates and where necessary implements its policies. So for that I can't train, then like how often we get a situation there, let's say you even train somebody for clean. Because I don't can work under you 2 weeks. As he left say don't work under you 2 weeks, and they go talk saying don't turn to master cleaner because you don't work for Dr. Thomas Macaulay. That is not the case. That is not the case. I didn't learn in fact, I'm still learning. If you're not humble enough to understand, you'd never stop learning when especially you're dealing with, at least in my own profession, learning not is stop. And if I feel say I don't too big for approach, the one that we don't get experience way past me, they might have not even studied the most sophisticated aspect, but the level of experience not in a textbook. So if I can approach them, if me able to approach them and say, I'm having this situation and this is my feedback. What you think say I don't do wrong, or what you think say you go do differently for we benefits the patient. That is a more mature way to approach treatment, especially when it comes medical. Okay, because I'm not a man body, not to animal, not to plant. I mean, it's not a hobby. Yes, it's a hobby when you're really passionate about it, but also you have to take the responsibility of knowing that when it goes wrong, it goes really bad. Now, policies for support, like I think one thing we don't try so far, although it's not moved very fast enough, now we have what we called Sierra Leone Private Healthcare Federation. The Sierra Leone Private Healthcare Federation, I'm part of the executive board. We had this established just as recent as later last year. It engulfs every aspect of anybody when you do anything in medicine. We have made it as easy as possible for even people them when are like Baba and people that we get salon for also become member, but helping them to regulate them better and equip them with a bit more responsibility because at least they have a bit of guidance and also the government, the app for work with we as the federation for come together for say, okay, this is not the boundary way you're supposed for because a lot of them, I know they blame them. Nobody never meets them, nobody never stop them. So just to do, trial and error. You know what I mean? Which is also very unfair. You want to do something, you're passionate about something, sign all day for doing somebody call you from Nigeria, oh, now this and they do that, or any other country, I not call one country name, right? Or wherever, right? You go sometimes you self be go through the training, you conscience they tell you, say, not on me place this, right? Now, you might not be a nurse will make you qualify for perhaps go through this kind of training, or senior qualified nurse for go through this training. But perhaps you can work inside the medical aesthetic industry in some capacity where you can still able to do some part of your passion or what you're passionate about. I mean, that is why we're bringing it here, for open up a market, for open up business opportunity and chance for people then for learn this, but at least responsibly. You can still make your money, but do it responsibly.
I think on the side of the practitioners, there's a whole lot of responsibility, but I feel like we, the clients themselves, we have a whole lot of responsibility. Yeah. I think, say, now we responsibility for find out, be informed, and ask as many questions as possible. Let we set your own conscience, stay at ease for whatever procedure we're going to do. So what would you say now the key thing them way people then for think about before making this decision to, put things in our body, go for IV drip, glow injection, whatever. I saw one on TikTok. They take blood from somewhere and they put it, I don't remember if a person and them in the inject, and I'm just looking at it like, oh my God, what's in the gun? And the person where they comment, he say, this one here, I believe say is safe because na your own blood then they use. I'm just like, you don't know who side, if this person they inject on at the right side, who side they go put on, is it gonna flow properly? Is it going to explode? Like, you don't know all of that. So what do we really need to think about? What are the key things so that when people listen to this or when person watch this, it go help them for make informed decision?
Yeah. First of all, I beg anybody we want go take blood, especially to deal with the blood. Anybody who want to take blood by you, right? We're not a medical practitioner, avoid. Okay? The one main issue, sterility. We talk hepatitis, HIV, and all that, and all kind possibility of getting certain infection where perhaps we know sabi treat safe now, where they talk about antibiotic resistance and all that thing. So for let somebody we not medically equipped go take blood by you, begin practice medicine by you, it's not done. That's the reason where parliaments now, England, UK, anybody on BBC go see the documentary, then it deal with that issue they big time, because that not the one way you need to left for realize immediately, say, oh, something wrong don't happen. Sometimes 3-4 months later you begin sick. Sometimes, just small thing will go wrong with that sterility again, because their equipment and they weigh anything for do with blood, then get for decontaminate them properly, then get for sterilize them properly, the needle then get for be sterilized. I mean, sterile needle, any equipment where they go inside your body has to be sterile. We did talk about all the other challenge that we don't get in a salon. I mean, we really not on learn for make sure, say, we take that responsibility, say, waiting the cancer in body, I get for be more cautious about it. You get underlying health conditions. In my practice, before you can do anything, my staff will probably send you a medical intake form to save your time. So you not get you not get explanation, say, oh, let me go show you answers until you don't understand. What you want, as you book your appointment for something, will they send you a medical intake form? Confirm waiting are you concern them, answer certain question. Based on that question, the way you answer, I get chance for review your file in person. When you go to see somebody who takes that responsibility, if not a lab test, the lab get for give me feedback, I get for read that feedback there, and then see if not something where maybe I need to treat you before, or we can proceed, especially when you deal with people that will get hypertension, diabetes, Like when you say
These are-
weight loss and things
These
like
are
that.
the things, because even for something as common as diabetes, this is not something where people they don't know say they get. These are underlying conditions where you go to hospital for one treatment, they not even ask you, and this is in the mainstream healthcare system.
Yeah.
You go to hospital for one treatment, they don't ask you if you get diabetes, high blood pressure, whatever, and you're being treated for something, not that the treatment they've given you does not work for that thing that you went for, but because of your underlying conditions, it just exacerbates whatever conditions you have, and that ends up making you feel worse. You go into this clinic, say you want IV drip for glow or whatever, but then say you have diabetes, and sometimes the content of that IV drip doesn't really work well for someone who has diabetes. So you go glow maybe for 1 week or 2 weeks.
And then
and
they glow take different angle.
you know,
I mean, I see that a lot with my weight loss clients. Now, we live in a country where a lot of people don't go for general checkup. So that's the other problem. So those are the ticking time bomb. They wonder way, no one they gets GP, no one they get gynecologist. They don't know if their family then get certain hereditary problem, kidney failure, and then one then they go, oh my God. They're the dangers because you be lucky if that person they work a normal come on na your office or wherever you call your clinic, right? Or whatever you call your location, and problem not for only.
Right.
You just go, even the drip where with the overused drip for most facility.
Yeah.
You go on drip where doctor admit for 2 days, then give me 16 drip. I can sit on chair. I'm like, what? Probably you're walking around with just water on your body right now, because then just the give drip now this country left, right, and center. Now, when you overdo things and you get away with it, you get comfortable. I don't sabi this work. Next patient can you do the same thing because one you want sell, you want make money. There are other things that you can do. But when you begin take denting and you don't know what's at the person in liver situation, now we get even kush situation back among young people, drug addictions, and all that. So where you go, ask for the NTR. The doctor supposed for get certain lab foundation for see what you can with. And perhaps it might not be what you even want, but it can recommend something even better. We can help for improve the lab result and the way it collects. You understand?
Yeah.
So you have to trust the physician that you're seeing, that they would guide you accordingly.
Yeah.
I'm hoping those people offering IV treatments, these aesthetic health IV treatments, are people who have that value, say, you offer treatment, but you take the responsibility behind it. And if certain treatments that you give person, you have to follow up with them as well. Sometimes 42 hours later, 72 hours later, how you're doing. So take that responsibility, say, you don't also administer something and not just let you place a goal.
How would you say we should think about it? How would you say we should approach this subject of beauty and, cosmetic procedures?
First of all, choose who you go to meet. Meet somebody who takes the responsibility of treating you. If it's cosmetic, then meet that person just for cosmetic reasons, meaning that person should be experienced, they've trained, they've got X amount of years of experience. Now, some people have got X amount of cosmetic experience, but no medical background. Okay? So when that person has cosmetic experience but no medical background, you can either, if you feel your condition has a medical nature, it's a choice that you have to ask yourself, is that the right person to go to? These days, there's laser, there's PRP, there's this. Some of these equipments are not FDA approved, which mean radiation as well. Radiation, actually, in the medical field, where you go inside for the radiation, the wall itself, a thick wall with it keep for protect people the way they're outside. So, say for instance, you go and you're not belly man, and you don't any pass radiation equipment, but you get belly. That's not smart. You understand? So the person where the equipment, the way they come inside, and something where the system need for regulate the equipment and the radiation board, I think say then they try, but I don't know how far they don't understand the level of influx of some of these equipment. Then also just some of the equipment and the way you go buy them second hand, where you bring them come, because they're not regulated, where it costs the boundary, where you don't come, they could be leaking. It could be leaking radiation, which means, yeah, you feel so you heal, but it damage your cells otherwise. And then the other harmful aspect is the extent of which the treatment where you perhaps need. Let them not go market for do something to your body where they above cosmetic level, which should be really done by medical procedure, which is considered a medical procedure, but you just go allow them because they advertise them to you. So when somebody advertises something to you, you're not sure, ask questions. Where you don't ask questions, perhaps do a bit more research. If not just superficial, a cosmetologist is absolutely, a trained cosmetologist is absolutely equipped to do those procedures.
Yeah.
And we do have at least a couple of good cosmetic companies in Sierra Leone. There's a lot of healthy foods we can all try to eat that improves the cells that you have. Yes, certain things the way for let you achieve the same dosage like waiting the IV, then they go get, for instance, like the vitamin C IV. You'll get for it quite a lot of orange every day for let you gain the opportunity there. So that is why they put them into a medicinal form instead of you just say, man, because it's not realistic for you to just eat oranges every day for let you just achieve a certain amount.
Yeah.
But in terms of improving, we all can improve with diet, not just as adults, but as a general practice. I notice we don't begin try for do a bit more diverse level of agriculture with more vegetables coming into the market, but perhaps the agricultural industry can work better on that. Try to bring more variety of fruits and vegetable, some of the foods that we eat, but also hydration, the amount of water we drink. If you do take care of your water inputs, you protect your skin. We live under a very hot climate. So I stay under the sun for so long. I cover my face because if you expose to the sun all the time and we pour makituma them, if you look at their skin, it can end up get several colors all over their face because most of the time they don't even remember that stuff. So a little bit of some of the information, which hopefully next time we have an opportunity, we can talk more about. I've been doing medicine for many years, so I know the challenges in providing quality healthcare in Sierra Leone. But maybe people they also keep it in mind that if certain procedures are too cheap, it's concerning. Okay, and if somebody force for market certain procedure too much to you, that's another red flag. And 3, if the person they explain how this they make you make so, but it not sound like say the information where they give you can guarantee you that long-term effect where you supposed for understand and value yourself, but that's self not concern. Ask and also pulling products and from.
So basically, I hope people are more cautious about these things. I hope sometimes this don't make people raise their eyebrows more, start to think about, being more cautious about what we put inside everybody, because this body, we take go, and we should really be careful what we put into it, what we eat, what we take as injection, and we have the right to ask questions. Then also, I think, is very important. So thank you.
Thank you, Antonia.
Thank you for making the time, and thank you for being on Honestly Speaking.
That's it for today's episode of Honestly Speaking. Thank you for listening and being a part of these important conversations. If you've enjoyed today's discussion, please like and share. And if you're feeling inspired, do leave a review. I'd love to hear what you think. And of course, carry on the conversation online. Share your thoughts, experiences, and ideas using hashtag HonestlySpeakingSL. Until next time, stay curious, stay engaged, and stay honest.